Dexaflox sterile ophthalmic suspension. Contain to active ingredients. 1. Ofloxacin. 2. Dexamethasone. Ofloxacin, which is a quinolone antibiotic. Dexamethasone, which is a corticosteroid with anti-inflammatory properties. Ofloxacin 3 mg per milliliter plus dexamethasone 1 mg per milliliter. Let's start Dexaflox drop indication. Indication or uses of Dexaflox eye drops. Eye drops is used for corticosteroid-responsive inflammatory conditions of the anterior segment conjunctiva, cornea, eyelid. Steroid-responsive inflammatory conditions are those inflammatory disorders that will respond to corticosteroid treatment. The anterior segment refers to the frontmost region of the eye and includes the cornea, iris, and lens. Conjunctiva lines eyelids and surface of eye. Sclera. Cornea. The second use of Dexaflox drops. 2. Where bacterial infection or a risk of bacterial infection exists in conjunctiva, cornea and anterior segment of the eye. How to use Dexaflox eye drops. Always use Dexaflox exactly as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. The recommended dose is 1 drop in one or both eyes, for 2 to 6 times a day in the affected eye. In severe cases, treatment may be started with 1 drop every hour at the start of the therapy, but dosage should be reduced to 1 drop every 4 hours when a favorable response is observed. Do not stop using the treatment abruptly. Gradual tapering off is recommended in order to avoid a relapse deterioration. The duration of treatment will generally vary from a few days to a maximum of 14 days. Side effects of Dexaflox eye drops. 1. Visual disturbance. 2. Tearing. 3. Inflammation. 4. Redness. 5. Sensitivity to light. 6. A feeling that something is in your eye. 7. Eye swelling. 8. Swelling around the eyes including eyelid swelling. 9. Eye pain. 10. Dryness, mild stinging or burning. Pregnant women and breastfeeding women. Tell your doctor before you start using Dexaflox if you are pregnant or if you are breastfeeding. Your doctor can then decide whether you can use it. Use with contact lenses. Dexaflox contains benzalkonium chloride, which may cause ocular irritation and discolor soft contact lenses. Generally, wearing contact lenses is not recommended in patients receiving treatment for an eye infection. If you are using other eye drops, wait at least 5 to 10 minutes between putting in Dexaflox and the other drops.